for us to catch up with our friend, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
So Matt was just talking about the daylight saving time. The clocks will go back this weekend. How can we do our best to adjust, Doc?
Right, great question. So let's talk a little bit about this. So most people get excited because they're getting an hour back.
Yeah.
But studies show that usually people, struggle with sleep. Sleep patterns get, a little disturbed. And in some cases, there may be an uptick in depression episodes the week following this time clock change. So things to keep in mind. What can we do so that our body adjusts more, better to this extra hour that we get? So people that tend to struggle the most are the early birds. Those that go to bed early, wake up early. Hint, hint, there's some of us here.
Yes.
So those folks, it would be good on Saturday if you want to change your clock ahead of the actual change in time and stay up an hour. Try to do an activity or something, not just sit on the couch.
Yeah.
And what also you can do is the days preceding, so I.e. now, and the next few days, try to go to sleep 15 or 20 minutes later than usual. Try to get your body into that rhythm.
Gotcha.
There's some sunlight you will get as a result of these changes early in the morning. So try to grab that because we know how important light is in order to reset the body's internal clock, the circadian rhythm, right? It all the wake and sleep cycles all depend on light to a great extent. So try to utilize that. And then leading up to the time change, also make sure that you keep in mind your meals. What time are you eating your meals? What time are you putting in your exercise if you go to the gym, for instance, or go for a run? Because all of those are cues for the body as to when it's time to start shutting down and getting into that sleep mode.
Yeah.
Stay away from screens. Stay away from caffeine a few hours before bedtime. So all of those things taken together hopefully will get your body ready for this time change.
Yes, we have to be proactive. I remember last year, it just seemed so easy once it's dark at like 5 or 5:30. It seems so easy to just go to bed.
Right.
But that may not be the best.
Right,
in the long
absolutely.
run.
No.
Yeah.
Because then you'll be getting up really, really early
Yeah.
too. So things to keep in mind.
Okay, now our next topic is about weight loss drugs. It turns out that it's helping a lot of folks in bringing down the country's obesity rate. So tell us a little bit more about that.
Yeah, this is promising. And this is based on the blockbuster GLP-1 agonist that got launched in 2021, Symphony. So by those, I mean semaglutide, which is, Wegovy or Ozempic, or tirzepatide, which is Zepbound or Mounjaro. So this is a Gallup survey that looked at U.S. adults, and the rate decreased in 3 years from 39.9% to 37% of adults that are obese. So it's a welcome trend. It's a small change, but nonetheless it's important. And the number of people taking these drugs actually doubled in the last year and a half.
Wow.
Now that's good because we know they're based on evidence, based on data, that there are other beneficial effects for patients when you do reduce obesity, has a positive impact on diabetes, on cardiovascular health, and other areas. But we do know there's some speed bumps coming, which we all need to keep in mind, including making sure our insurance plans continue covering some of these drugs. There are also pills that are in the research stages, but that's still, a little bit away in terms of getting to the market.
Yes. All right, now October, we are wrapping up the month of October, which means it is Breast Cancer Awareness Month. What tips do you have for our viewers regarding preventative services?
Right, this is an important month, and it raises awareness of breast cancer, both for screening, because early detection is great because it can lead to treatment and cure for breast cancer, high survival rate. And also supporting those that did come down with breast cancer and research. So all of that is packaged into this month to raise awareness. Now what you can do if your average risk is get that screening mammogram from age 40. Make sure you have an appointment with your primary care doctor to discuss, are you high risk or average risk? There are risk factors that may push you into the high risk category. And in that case, screening may start earlier than age 40. But all things to keep in mind, make sure that you get the appointment made for the screening mammogram.
Yes. So reach out to your loved ones, moms, aunties, whoever, and remind them to get those mammograms. I'm going to give Mama Privet a call.
Yes, and even though this month is centered around that, it's the entire year that we need to keep this disease in mind.
Yes. All right. Thank you so much for joining us.
Thank you.
We're going to check back